Hello and welcome to the Southern 7 podcast. I'm Shauna Ryan, Community Outreach Coordinator for Southern 7 Health Department and Head Start. Southern 7's main office is located in Olin, Illinois, with clinic offices and Head Start sites serving each of the lower 7 counties in the state. The Southern 7 podcast is a service provided by Southern 7 Health Department to help you and your family live better and stay healthy. If you like today's episode, make sure to check out all of our podcasts by visiting southern7.org or downloading the Southern 7 app. So listener, you don't have to tell me, of course, but how old were you when you had your first real doctor's appointment? You know, the one without a family member in the room like mom, giving the doctor all the details about your runny nose over the past month. I say that because as a mom, I've done it. Anyway, you're probably old enough that you could have been seeing the doctor by yourself, right? Well, that's what today's episode is all about. We're going to talk with 2 adolescent health experts in Southern Illinois who are helping families help their kids establish lifelong relationships with their healthcare providers through wellness visits. Want to hear more? Stick around. We'll be back right after this.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Don't forget your child's back-to-school shots. Delaying your child's vaccines can lead to scheduling conflicts, longer wait times in the clinic office, and the chance that a vaccine may not be available when you need it. Keep your child safe and avoid the headache of scheduling late. Call Southern 7 Health Department at 618-634-2297 or visit southern7.org for a clinic near you.
634-2297.
Welcome back to the Southern 7 podcast. Folks, if you are a regular listener here at the Southern 7 podcast, normally we're coming to you from our little studio down in Pulaski County in a little town called Olin, Illinois, and that's where the Southern 7 Health Department is located. But today we are out on the road, and in one of our other 7 counties that we cover, we are in Union County today in Anna, Illinois, and actually we are at Rural Health Incorporated. So welcome, glad you're able to be with us today. Joining me here today is Dr. Lucas, as well as Jessica Short, and we're going to be talking with you about the adolescent health program that's taking place in our region. But we're going to go ahead and start with Dr. Lucas here at Rural Health, and I apologize, I don't have a first name for you.
It's Christine.
Christine. Well, I'll still continue with Dr. Lucas because that's where I am. But thank you so much for being with us today. Tell us about yourself.
I've been here at Rural Health since 1999 and have seen some changes along the way. We used to have 2 pediatricians here when I was in training, so they were both my teachers, Dr. Swafford and Dr. Pedrosa. And I like to think they got me off to an excellent start. Pediatrics is probably my favorite part of family medicine. No offense to you grown-ups out there. And I am working on enjoying adolescent health more. Sometimes that's a tough crowd, but when they come in, I do appreciate their honesty with me, and I am always happy to see them. That things just get a little more complicated with that age group than the babies. Anyway, I get to see all ages here at the clinic. I work at our Goreville site also a couple of times a month, and then I supervise the collaborate with the Dongola providers and the Metropolis providers, and then we also have a clinic in Vienna. So we try to make our presence felt in a positive way throughout the area.
So this is, the adolescent health program is not new to Southern 7, but it is new to Rural Health, right?
Yes.
And we're going to tell our listeners a little bit about that program here, but first off, why? What's the look?
I am probably not the best person to explain the program. I'm just trying to do what I do. No. This is what we want you here. We're going to have Jessica tell us all about the program. So don't worry about that part. But, Rural Health has been in our region for many, many years. Do you have any idea how long Rural Health has been here? Oh, goodness.
I have to say at least 30, maybe more.
I would say possibly 40 years.
40 years.
I know Dr. Beatty, who recently retired, was one of the original providers, and then Dr. Rubin came on board shortly thereafter, and he's been with Real Health at least 33 years, I believe.
Yeah.
So, yeah.
Long time.
Been a
Long time in
while.
our communities. And about how many locations do you have?
We have 5 clinics.
Okay. And all of them are located inside the Southern 7 region?
Yes.
Okay. Very good. So we're looking at, we said Anna, Vienna, Dongola, Goreville, and Metropolis. Okay, yeah, so all of those are located in the Southern 7 region, so very good. And you provide a wide variety of services to folks here. What are some of the primary ones that you do?
Well, we provide a full range of primary care on an outpatient basis. We have a MAT program, which is a medication-assisted treatment program using Suboxone. We have social workers and counselors available. We have a psychiatric, behavioral health program. We collaborate with nurse midwives and have on-site OB ultrasounds and a dental office.
Mm-hmm. So a lot in this one location for the folks that live in our region, which is something that we need. So
yes,
wonderful. Okay, well, Dr. Lucas, thank you so much. Jessica. Now, Jessica Short, you are a health educator, one of our health educators at Southern 7 Health Department. You and I have talked about the Adolescent Health Program last fall, I think.
I know, time flies.
It's been a little while. But for our listener who might not know, what is that program and why is it so important here?
Sure. So this is actually going to be, this grant runs on a fiscal year. So it's starting July 1, started the new fiscal year. So it's a July to June grant. And we are in year 4, actually, of this grant. Basically, this grant tries to help with education, awareness, and outreach for adolescents. And when we say adolescent, we mean anyone who is 11 to 21 years old. That's what the grant covers, to get a well-care exam at least once a year. This grant is funded primarily through IDPH. It primarily focuses in Union County, but we just, in the last year or 2, started to work with schools, other social service agencies in Massachusetts County and Johnson County. Also do some things in Pulaski and Union County and Alexander County, but primarily it's to make sure that kids are getting in, young people, not kids, are getting in to see Dr. Lucas or another doctor to make sure that they're getting their visit. And primarily when we're in schools, if we are talking to people, we'll say like, well, have you had a sports physical? Yes, we have. And then it's like, well, did you get a well-care exam? And they're like, what's that? Yeah. So sports physical, everybody knows, it's just, yes, you're cleared to play baseball or basketball, but a well-care exam is a more comprehensive exam. They're going to go over many more different things about your body. You're going to get to talk about things at home, at school, just kind of develop that relationship with Dr. Lucas. I'm sitting across from Dr. Lucas right now, and it's just feeling comfortable talking to a physician and not feeling like you can't say what's going on, because they want to help, but you got to tell them what's going on so they can help you. So just getting that skill level developed, and obviously if you're 11, it's different than if you're 18 going in to see Dr. Lucas. But primarily it's to make sure that, young people in our region know what a well-care exam is, know how to schedule one, and then know kind of the skills that they need when they're in a visit. Luckily, Rural Health agreed to partner with us on this, because I think when I talked to you last fall, Dr. Kathy Swafford, longtime, well-respected pediatrician, was our partner, and she's decided to retire and close her practice. So we were looking for another organization to come on and partner with us, because we're obviously not providing, the services that Dr. Lucas is. We're providing more of that education and outreach and going and talking to students in schools about why it's important. But luckily, past spring, Rural Health said, yes, we'd love to work with you on this. And thanks to Dr. Lucas and her colleagues here, we were able to continue this into year 4 for our region.
Well, like you say, since it's expanding, it's important to have an agency like Rural Health on board to bring those services throughout the region instead of just Union County, which was kind of our focus in the beginning. So that's exciting to see that. And the other side of it too, starting this program at those ages, kids today are learning and hearing more about those preventative care measures Mom and dad are getting mom and dad are getting mammograms, colonoscopies. They're hearing more, they're taking in a whole lot more. So they themselves are starting to be more preventative. COVID kind of pushed that along a little bit too. Right. So this just really kind of takes that to a whole new level. So in looking at those well care visits, what are some things that take place at that well care visit?
So they're going to do height and weight and blood pressure, and then probably going to do some screening for any mental health or behavioral health concerns, and then probably do some talking about physical activity or healthy relationships, obviously immunizations as needed. And I'm sure Dr. Lucas could give a much more extensive answer on what goes on in a well care visit, but it is a longer appointment with your healthcare provider than just a sports physical. Not that those are not important, those are important too, to make sure that young people are cleared to engage in athletics, because we want to make sure that young people are safe when they're playing sports. And it's also too to just make sure that a young person doesn't go a year, 2 years, 3 years without being in front of a healthcare professional, especially with COVID-19. Sometimes, maybe people got behind on some screenings or some tests or just being in front of a physician. So just want to make sure that because it's like everybody does their, 9th grade appointment. And then I know when I was in high school, it's like, oh gosh, did I even go see my pediatrician or my family doc, for when I was in my high school years? And it's like, well, yes, we want you to do that because it's a very important time as you're maturing and just different things that, are going on. It's hard enough being a teenager, so we just don't want it to be where you're years without getting in front of a healthcare provider.
So in looking at the difference between a well care visit and a sports physical, because you hear that a lot from parents that, my son or daughter, they got their physical, but it was the sports physical. Dr. Lucas, what is the difference in those? What are you looking at a well visit that you might not during a sports physical?
Well, a few things on that. One, I would just want to reassure all the patients in this age group that if you don't want to be weighed, it is always your prerogative to decline that. I would encourage you to at least know for your own benefit, even if you don't want it in the record. If you haven't weighed yourself lately, sometimes it's helpful to just see a number, but it's not all about the numbers. I think the blood pressure is probably the most important one because we are seeing high blood pressure in younger ages. Part of taking a little more involvement in your own healthcare is knowing your rights as a patient, and you can just always say no thank you to that, or just no. So I just wanted to add that in real quickly. The sports physical has evolved over the years since I've been in practice. It's much more focused now on risk factors. So the parents, I joke with them that their work is more extensive than mine for that because it's a multi-question questionnaire. I think it's 30 to 40 questions, and it's trying to get a sense of which kids have a higher risk of problems and certain things we need to look at more specifically. So the exam is pretty limited, honestly. It's really getting the background information, the family history, to make sure that there's not things we need to do. And really it just says, are you safe to play a sport? Which almost every child is. We want them to be active, and so that's usually if their blood pressure is a little high or what have you, or their weight is a little bit more than their height would usually recommend, being active is going to be the best thing they can do. So we would encourage them to do that, but we don't spend as much time at that visit talking about things, which at a well care visit at any age, ideally, there would be time for some discussion. That's easier when you have a relationship with the patient. Otherwise, I feel like it ends up just being a checklist of do this, don't do that. And I think patients of all ages hear that from enough places. I try not to just say, wear your seatbelt, read some books, eat your vegetables, I'm not sure how helpful that is. Yeah. But when you know the patient, you've been seeing them for a few years, then sometimes you can dive in a little deeper. They feel a little more comfortable sharing some bigger issues with you. And you can really use the time of a well visit to focus on their needs that are more long-term, I guess, than just like an ear infection or a knee sprain or what have you.
Well, like you say, this is for some of these kids, this is their first actual adult-like doctor visit, physical exam. It helps them to also get comfortable with talking to a physician about certain things or concerns or what have you, instead of waiting until they're older and something really comes around. I know with my own kids, we encouraged our children, don't be afraid to talk to your doctor. If you're having a problem with something, that's what you tell the doctor about. And I think a lot of kids just leave it to mom or dad to say, okay, this is what's wrong with me, this is what's going on. But the kid needs to know that they're also being proactive with their own health care, and that's really important, especially when you're looking at these early teenage years. So I love this. This is great. For parents and caregivers, why is a well care visit important when their child is healthy? Again, you know, they're getting that sports physical maybe. You know, my kid's not showing any problems. Everything's looking good. What would you tell a parent that says, my kid's doing fine? Why shouldn't he or she do this?
When suicide is one of the highest causes of death for that age group, I just don't think we need to say any more about people seeming healthy. That has been an incredibly huge change in kids' health, adolescent health, since I've been in practice. And just the fact that that has become a leading cause of death of that age group across the nation. You can seem as healthy as you can be, and as we know, that's not always the case.
Your brain can get sick too, and there's no cast, there's no swelling on your arm.
Yeah, right.
Yeah.
And that's kind of what, like what you guys are talking about. We use the term adulting. I'm doing air quotes to our listeners. But like we'll go into like a room of like ninth graders or sometimes juniors and seniors, and it's like, well, what is adulting? And it's like, what does that mean? And they're like, being organized, or like having a job. And it's like, okay, well, in terms of like going in to see your doctor, adulting can just be having a trusting relationship with that person. It's a working relationship. They're on team Jason or team Tina. Like they want you to do well in school. They want you to do well at work. They want you to do well in your relationships and in your schoolwork, and possibly going on and getting a job or going to college. But just seeing that person as an ally, as an advocate, and that they have your best interest at heart, and then maybe sharing some of those things that might be, a warning sign to someone like Dr. Lucas, who is trained to know what to look for, to know what questions to ask, and getting those, screenings instead of just somebody white knuckling their way through it and suffering in silence. We don't want that for our young people. We want them to go get the help that they need and not feel like they're alone in that and trying to do everything by themselves. So that adulting message is going to be different for like an 11 or 12-year-old versus, me talking to like 16 or 17-year-olds. And just things like, what insurance do you have, and what's the number, and am I on my mom or dad's insurance? And then for parents, it's like that time when you're like in the appointment, and then maybe you let your 17-year-old or 16-year-old go in on their own, and how do they navigate that? And you're not in the room, and how do you feel about that? So just having those conversations and using it as a point of kind of developing those skills, so that we're kind of teaching generationally, what healthcare is, how to access it, what questions to ask, how to advocate for yourself, and not just going it alone and maybe not getting the care that you need. So.
Growing up, I can remember it being a regular part of your visit, especially if you're switching doctors, to have that initial patient consultation, to where you go in and you get to know the doctor gets to know you, and it's in a very almost informal type environment. And I still encourage that. I think it's something that patients need to do. Do you see a lot of that? Or are people just calling you when they need you? I mean, I think those initial consultations of just getting to know that doctor and having a time for that kid to sit down and just have that relationship building time without there being any pressure of anything else they might be afraid of. Do you encourage that still? Is that something that we're seeing?
Absolutely. I love those kind of visits. Ideally, that would definitely be the way a relationship would start. We have been very fortunate to be able to take on a lot of Dr. Swafford's patients, and we are trying to set up that exact kind of appointment so they can get familiar with the office flow. I mean, it's obviously much different than, one doctor, one PA, maybe a small office to this whole group situation over here. And I try to, tell them the benefits of that, where they can almost always be seen the same day. It may be with someone else, but also just to welcome them to the practice and just talk about, how to access the on-call person after hours, which is simply to just call the same phone number, and we use an answering service. Get to know some of the nursing staff, because they are going to be the ones, giving the immunizations. So getting some kind of comfort level there. Just getting to know the family dynamics, their interests. Yes, I love those kind of just get to know you visits. I think it's perfect when it can happen.
Good. I'm glad that's still encouraged. One of the things that we wanted to cover is when you're looking at the development of a child and you're looking at the mental health development of a child, those early exams can show you so much. But what about when you have a kid that is just really, really hesitant about doing it? What can parents do to try to encourage that? Going to the doctor's scary. Especially if you're somebody that doesn't like needles, you don't like all these other things. What can a parent really do to help encourage a child to ease their fears when it comes to those initial visits?
Jessica, you can take that one.
Besides just regular bribery, which I have to admit I did on occasion.
No, yeah, I mean, I think it's so case by case in terms of like maybe the situation that you had when, if you're the parent now, it's like, well, what was that like for you when you were young? Was that modeled to you about, we go to the doctor, not just when, we're running a terrible fever or something's happened and you've, broken your arm at soccer practice or something, but just, hopefully, that's modeled to a young person, and then they end up, if they choose to, getting married and having children, then modeling what their parents taught them. So hopefully that's something that, again, is just taught, generationally about taking care of ourselves and why we do that, and that we love ourselves enough to take care of ourselves, and we don't just neglect our health and we're running all over and we're not doing that. So hopefully that was modeled, but if it wasn't modeled, then that's okay too, because we have all walked our own path, and everybody's journey is their own. We're not sitting back here as the health department, like, oh, shame on you for not doing XYZ. We're not coming at it from that. We're coming at it from we're in this with you, and especially coming out of COVID and that national crisis that was obviously a healthcare crisis for a lot of people. A lot of people suffered a lot of losses in that and many different aspects. So it's just coming at it from hey, we're here with you and partnering with you in this. And even if that wasn't a message that you received, well, let's kind of start from here now and just kind of deliver that message of there are things that, Dr. Lucas might screen for that maybe you wouldn't be able to see it through the lens that she would see it through, coming at it from again, we're meeting people where they are, and whatever, your experience was in the past, it's just that messaging piece of, I think, love yourself enough to spend the time on yourself to make an appointment and to get in. And, we have a lot of respect for what Rural Health does, and they've been around doing that for a very long time. So I know for our health ed team, we're really lucky that they wanted to help us out with this grant to get that messaging out there. So I don't know if that was just a bunch of word salad, but it was those are some of the themes that come up as a health ed team when we're talking about the messaging on this grant particular, as far as what is the goal, what can we do to reach that goal, and how can we support our community in terms of the aim of this particular program.
Right, and when it comes to your kids, parents will model you as a parent. They'll model the grandparents and what they're doing. So if you're a parent who's getting regular checkups, encouraging those types of things, even eye exams and going to the dentist, which you can get dental care at Rural Health, children will pick up on that. And they will see the benefits of it. And I know in my home, when we've gone through healthcare issues, we talk about it. We sit the kids down and go, okay, guys, this is what's going on with grandma, or this is what's going on with us. We let them know this is part of life, and this is what you do to stay healthy. Just those conversations, that initial consultation, letting them get comfortable with their doctor, it's just so important in these early years. And you hear parents say, well, you're just going to get a shot when you go. Well, that's pain. You got to look at, you got to try to explain it in a way that, okay, yeah, you might have to get a shot, which you're not getting a shot during your well visit necessarily, maybe, but that's designed to keep you healthy and to do those things. So definitely so.
I definitely cringe when I am walking in the room and that kind of verbiage is happening. Or if you don't behave, they're going to give you a shot.
Oh, yeah.
That really makes us into the bad guy.
Yeah.
So if the parents have said, I promised them we wouldn't do any shots today, I never do any. We'll just do them another visit. I mean, I just try to, some kids you can't say we're doing shots today because they'll just be so anxious until it's done that they can't even hear anything, and they just get more and more worked up, and it's really sad and painful to even watch. Mm-hmm. But most of the time I try to set expectations from the beginning, yes, we're going to do one, immunization today, we'll get that out of the way, and then we can talk, or however it seems to work best for that patient if I know them well enough to do that. But if we stay with the scheduling of the immunizations, which I do recommend, it's really just what used to be at 9th grade is done at 6th grade now. So 9th grade shouldn't need any shots, and they really just need one booster when they turn 16. Mm-hmm. There's a lot of visits in there where there shouldn't be any needles involved. But again, I just try to downplay that as far as not being the main reason that they're there, but also that we're just doing that for their safety and protection. And sometimes if there's siblings there, they're worried about or maybe they want the other sibling to take more shots. But, I try to explain, the purpose of immunizations, that we're not trying to hurt anybody. We are working on new ways to get that protection besides needles, but right now we don't have it. So that's just a really smart decision they're making to get those immunizations, and try to commend them for being so brave. Those are some of the approaches that I've used, I guess.
Very good.
To get over that needle phobia, which is a real...
It's a
real thing, of course.
Yeah, adults
even
have
for
it too.
adults. Yes, absolutely.
Exactly. Okay, we've covered a lot of information here today. Is there anything else that we've not covered?
I don't think so. I mean, if anyone has a question about how to find an office, kind of be the bridge to getting in, like what are those numbers and how do I do that? That piece, we can always help with that too. Or like if, their doctor's left the area or they're new to the area, we can always, kind of help them find, rural health or find, whatever help they need as far as that. But we're always available for that. I don't think I said that earlier. So
it's okay. Sounds great. And Dr. Lucas, how can they get in touch with Rural Health?
I would call our main number, which is 833-4471. And we have a great team of receptionists. So we have that. It's just one phone number to access us. Okay. Once you are established with the provider, then each nurse has their own extension, and we do try to, check those messages multiple times throughout the day. So then that gives you a little bit of a shortcut. We'd love to have you. We are taking new patients of all ages.
Very good.
And if someone is experiencing any kind of suicidal ideation, or if someone's worried, there's always the suicide, text line 988, and there's always the crisis text line 741-741. So.
Okay. A lot of ways to get in touch. So thank you so much for that. All right. Well, ladies, thank you again for meeting with me. I learn something new all the time when I sit down with you. Dr. Lucas, thank you for your time, and thank you for your support in the program as
You're
well.
welcome. It's a privilege to be here.
Very much.
Can't wait to meet some new adolescents.
Yeah, exactly. Well, I know Jessica's going to keep us posted. We'll come back and probably do this podcast as we start rolling through, maybe in the fall again, just to kind of see where we are.
Okay, sounds great.
And since it's constantly kind of changing and growing, which is exciting, we want to make sure we keep everybody up. So thank you. Thank you so much. All right, folks. Well, that's going to wrap up this episode of the Southern 7 podcast. Thank you so much for listening to us today. If you'd like more information about the Adolescent Health Program through Southern 7 Health Department, you can give us a call at 618-634-2297, and you'll be directed to the clinic nearest you that has the information that you need. You can also reach out to Jessica directly at 618-833-8561 and visit us online at southern7.org. Thanks again for listening from all of us at Southern 7 Health Department and Rural Health. Have a wonderful day.